So, hi everyone. I'm very, very happy to have with me a dear student, Dr. Nishtha, and she has secured an amazing rank 13 in May INI-CET 2025. So amazing, Nishtha. This is absolutely awesome. Heartiest
Thank you, ma'am.
congratulations.
Thank you so
And
much,
how
ma'am.
I see a lot of calm on your face, है ना? तो अभी भी
मैम अभी
मुझे
तक आई एम
लगता
नॉट एबल टू बिलीव, मतलब बिल्कुल बिलीव नहीं हो रहा कि कैसे हो सकता है
I
ऐसे, मतलब
was
फर्स्ट अटेम्प्ट में
going to say this. यही कहने वाली थी कि मुझे ऐसा लग रहा है कि अभी निष्ठा hasn't come to terms with that this is her rank. Am I right?
यस मैम,
But
बिलीव
this
ही नहीं
is
हो रहा,
amazing.
मतलब लाइक एग्जाम के बाद भी लाइक व्हेन आई सॉ रिकॉल, मैंने नहीं सोचा था कि इतनी अच्छी रैंक आ पाएगी। लाइक कुछ तो मैंने 4-5 तो बहुत सिली मिस्टेक्स करी थी, तो मुझे लगा था उसी से रैंक बहुत पीछे हो जाएगा।
I understand. क्योंकि competition बहुत tough है निष्ठा. Am I right? है
यस
ना?
मैम।
So great. But yes, this is where you are. I think it's a very well deserved rank, and I'm sure a lot of effort has gone into it, Nishtha. So
यस मैम।
मुझे बताओ कि यहाँ तक इस अमेजिंग रैंक तक पहुँचने में कितनी मेहनत लगी? And just to let everybody know, Nishtha has been a proud Damsonian for last 3 years. Nishtha, am I right?
मैम TND।
TND student with us.
यस
Perfect,
मैम।
great. So do let us know, Nishtha, how far, I mean this far that you have come, कितनी मेहनत लगी और कैसा लग रहा है अभी, है ना?
मैम अभी तो बहुत अच्छा लग रहा है, बस वही है एकदम से एब्जॉर्ब नहीं हो पा रहा कि हो गया सच में। और मेहनत
Absolutely.
तो मैम मतलब वही है, अभी फर्स्ट अटेम्प्ट में ही हो गया, तो इतना मतलब मेरे को तो नहीं लग रहा कि इंटर्नशिप के साथ साथ जैसे जितनी पढ़ाई हो पाई पॉसिबल उतना किया, और फिर उसके बाद 1 मंथ जो था इंटर्नशिप के बाद उतना घर आके पढ़ाई करी।
Absolutely. I know it is really difficult और अपना फोकस बना के रखना साथ में इंटर्नशिप भी करना इट्स नॉट इजी एट ऑल है ना
यस
तो
मैम।
निशा सबसे पहले आई वांट टू नो फ्रॉम यू बिकॉज एवरीबडी वुड वांट टू नो दिस व्हाट डू यू थिंक इज योर नंबर ऑफ करेक्ट क्वेश्चंस निष्ठा जस्ट अ रफ
एग्जैक्टली अभी
एस्टिमेट maybe
अराउंड 160 164 मे बी, मतलब अगर इतनी अच्छी रैंक आई है तो
so
मतलब लाइक
around
अकॉर्डिंग टू रिकॉल लाइक 150 to 154 were definitely correct. Like rest 10 to 20 questions which there was very discrepancy among all the institutes, that I
yes
don't know. Around 160 may be correct.
Great. So that's a great number of correct questions. And Nishna, we also want to hear from you कि what do you want to comment on the difficulty level of the paper or overall what is the assessment of the paper? Now the result is out, you have your rank, you know your number is correct. क्या बताना चाहेगी?
Ma'am, I felt the paper was on easier side this time. Like, matlab, many questions were direct. Like, you know them. Just
Yeah.
cancer cervix is caused by which HPV, and micro questions were also very easy. Micro and biochem were dominating this time.
Yes.
And so, matlab, I feel it was on the easier side, but there was some questions which, matlab, questions were also easy, but the options were tricky, like ABC or ABCD. Like, I know ABC is
Yes.
correct, but I don't know about the D option. So that type of questions were tricky this time. I was
Yes.
confused only among both type of questions. And some in biochem, mole bio was a little on the tougher side. Otherwise,
Mm-hmm.
like I would say paper was comparatively easy. Matlab, around 130 to 140 questions were like direct. You would be able to do if you have studied and done the PYQs.
Yes, yes. So coming to a lot of things that I have in my mind to ask. So अभी इससे ही शुरू कर लेते हैं जो तुमने शुरू किया. You did talk about the PYQs. So what do you want to say? Were they verbatim same, or do you think they were on the similar lines? But yes, the options were definitely different, I think.
Ma'am, some I guess the easier questions must be direct repeat, like some of the questions from micro and path
Mm-hmm.
must be direct repeat, and some of them were like the options were changed, but the topics were same only.
Yes, so it was more about actually PYTs. That's what we have
Yes,
to
ma'am.
keep stressing on.
Yes,
And
ma'am.
आप मुझे ये भी बताओ निष्ठा, what about the paper distribution and the time management? We all know that first and second year are more, have a little more weightage as compared to NEET PG. But what is your take on it? Any division on these subjects that you want to comment on?
Yes, ma'am. First and second series subjects were definitely on the higher side. And time
Hmm.
management, तो like now INICET has started sectional. So
Yes,
time management हो जाता है like आसानी से कि 50 in 45 minutes you have to do 50 questions.
right,
So मतलब what I used to मतलब कि last in 35 minutes I used to complete the section, and then the questions that I had left, like 10 to 12 questions in which there was doubt, that I used to complete in the last 10 minutes. So
right.
like this was my time management कि like I used to see कि मतलब जब 10 minutes हो जाए screen पे 45 to 35 minutes, then I was on the 16th or 17th question.
Hmm. Okay. And तो हमने शुरू से time management का ध्यान रखा. Also, some people are saying that section A was lengthier this time. Do you feel it was same for you as well?
I don't remember exactly the section A was lengthy. Like it may be कि starting में थोड़ा speed build up करने में time लगता है, so maybe that's why.
Yeah,
But
that could
overall,
be.
like paper was lengthy. मतलब it was not कि you are getting enough time to review your answers. Like once you read the question, you have to answer. And only
Yes.
at the end I was getting time only to see the questions that I had left. मतलब I didn't get any time to review the question that I had already answered. So I
Okay.
didn't mark any question for review, but मतलब second thought देने का time नहीं था. Like you just have to mark and go forward.
Okay. And what was the attempt ratio for you, बच्चे, Nishtha?
Ma'am, I attempted 194 questions.
Okay. And जो 6 हमने छोड़े थे, वो deliberate छोड़े थे? Were those the trickier ones, or what was about those 6
So,
questions?
ma'am, I answered like by eliminating the options. They were the ones which I've never heard of, so I didn't
Okay.
attempt.
Fair
Already
enough.
I was
Fair.
thinking I have attempted a lot 194 की बहुत negative हो जाएगा, but
Yes.
so
And especially
like
क्योंकि
the question,
multiple section वाले थे.
yes, ma'am.
Okay. And also, can you comment something on the image-based questions? What was the approximate contribution? Were they difficult? What was it like?
मतलब image based questions were easy. They were not like difficult कि मैं समझ नहीं आ रहा, ऐसा नहीं था. मतलब they were on the easier side. Image based
Right.
questions, yes, ma'am.
And now that we know this, निष्ठा मुझे ये भी बताओ बेटा कि हम डैम्स टीएनडी में we always ensure कि जो टीएनडी है वो PYTs बहुत अच्छे से कवर कर रहा हो, कुछ probable topics भी हों. So would you want to comment something on the TND, and how did you exactly use it during your internship as well? Because that is the best program to go along with internship, right? Hello? 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 Okay, I think Nishta, maybe the internet has stopped in the middle. But yes, so she has had a high attempt ratio, 194 she has attempted, and 6 questions she's saying she did not have idea about, she was left. She said that microbiology was slightly on the tougher side, as well as biochemistry was slightly on the tougher side. And the image-based questions were not tough. She's saying that they were quite direct, and she was able to sort of get through them. Okay, we have you back. I think there was a internet disconnection. अच्छा निष्ठा, what I was trying to ask you was कि हमने जब TND करा internship में, I want to know, one, the level of the questions that we discussed and the kind of discussions we had. Two, were we good enough in covering the PYTs, because that's the most important thing. And were you able to do it smoothly with your internship? Because जब कम टाइम होता है और एक बार कंटेंट पढ़ा होता है तो TND is a very good course to go along with, है ना?
Yes, ma'am. Ma'am, I like attended the TNDs of DAMS, and मतलब I will frankly say that DAMS TND I always felt that it is difficult than any other platform. Like मतलब starting
Okay.
with I used to get less marks only कि 100 में से like around 60 correct, 65 correct, like that only.
Right.
But फिर then धीरे धीरे like it improved. So I attempted
Right.
DAMS TND, and the discussion was also very helpful. And also I used to give yours and Sameer sir's radio and gynae telegram MCQs daily. Like they're very helpful if you want to revise like daily. मतलब gynae, for me, I feel gynae and surgery are the two subjects that are very volatile for me.
Yes,
I don't
great.
remember them very easily. So they were
But they
also very
are
helpful.
scoring,
Thank
है
you
ना?
so
इस
much,
बार
ma'am.
भी I think gynae भी scoring था, शायद surgery भी scoring
Yes,
था इस बार सेट में.
yes, ma'am. Gynae and surgery both were scoring.
Okay. And also, Nisha, I want to ask you कि हम जब prepare कर रहे थे, so towards the end, we sort of did the DBT, the LRR. Did you utilize these resources? And what about your
Yes,
CBT
ma'am.
scores? What do you think was the number of correct questions in them?
Yes, ma'am. I didn't attend LRR sessions. Like I attended DBT, live
Okay.
face-to-face classes. I attended for DBT. And
Okay.
in last 6 to 7 days, I only did DBT. Like last 6 to 7 days में मतलब कुछ समझ नहीं आता था कि what to study, what not to study. So I solely relied on DBT only, just DBT and PYQs in the last 7 days. कि
Yes.
DBT
And
अच्छे से कर लो तो
एक मुझे ये चीज पूछनी थी निष्ठा, क्योंकि DBT is concise, but yet it covers the significant amount of width and depth that is required. Do you think it is a good resource, especially towards the end? Now that NEET
yes,
PG is
ma'am,
also
DBT. Yes, ma'am. It helps in brushing up the subject like very easy. It helps in मतलब in exam if you have read DBT, you have a hold on the subject. Like you can recall. मतलब even if you have not read those topics in last days from your main notes, but then also it gives a like we can idea of the subject so that you can recall in the main paper. Like main topics are covered in DBT, and the things like tables and like in surgery DVT and gynae DVT, matlab all the things that we used to forget, everything is given in them.
Right. And Nishta, what about your CBT scores? What were your number of correct questions in the CBT?
Mama didn't give any CBT like that, matlab, because I
Okay.
came home after my internship, so I was not able to give any computer-based test.
Okay.
Uh,
What
I
about the
give
grand test?
grand test में like around in one like INI-CET वाले grand test में 150 correct, around 150 160.
Okay. So you're
Maybe around
almost
like
meeting the
150.
same number of correct questions.
Yes.
Okay, great. And any other insights into the paper? For example, among the third and the fourth year subjects, कुछ distribution का बताना चाहोगे? Because there's always some skewed distribution that is there.
Third and fourth year subjects में ma'am, like I would say कि medicine was not very deep, like as we should study for NEET, मतलब इतना deep में नहीं था. But
Okay.
first and second year subjects were on the higher side. Micro के काफी questions थे, path, pharma.
All right. So that is great. अच्छा, और कोई special tips बताना चाहेगी INI-CET के लिए? Now that you've given the paper, anything that you feel was really useful या ये चीजें हमें ध्यान रखनी चाहिए INICET के लिए, especially looking at the newer pattern where you had lots of multiple completion questions.
Yes, ma'am. Like INI-CET में like they focus more on the depth of the topic. Like, matlab they ask topics, questions on the similar topics, but in more depth. So we have to read the topic very, like, matlab we have to read the topic very conceptually, so that we can answer any question. Like, and mostly the questions are like, which of the following is correct about this, which of the following is not correct, and there are multiple type of questions. So we have to know everything about that topic. And बाकी
Okay,
like I feel कि eliminate करके हो जाता है options, like smart guesses. Like I would say कि 130 to 140 were definitive, I was sure of. बाकी I did just by eliminating and smart guesses only.
Okay, great. That's great.
And
And
that comes
also,
with practice only.
okay. And also, Nishtha, this time we've seen there were less clinical questions, more of one-liner based questions, right? That has been the pattern over the last two things. So, anything that you want to comment on that for people who are going to appear for the exam, in the November session?
Yes, ma'am. Clinical questions were less the time, and also the questions were not very lengthy. They were one-liners only. So, ma'am, for one-liners, I feel like DBT is must because it covers all the volatile things at the last. DBT or any revision tool that anyone is using, matlab should revise. Matlab I feel ki, matlab INICET is not like you study everything, and then don't revise in the last days. Matlab you have to revise for last 7 to 8 days. Then only you will be able to remember those things in the exam.
Great, great, Nishtha. So I think, Nishtha, are your mom and dad around? Is it possible that we can have them in the frame and we can congratulate them on this feat? I'm sure
Yes,
it's
ma'am.
a lot
Yes,
of
ma'am.
contribution on their side as well.
Yes, ma'am.
Let's hand them over.
Yes.
Namaskar, ma'am.
Namaskar, ma'am.
Heartiest congratulations, ma'am. She's done amazingly well. Getting this rank in her first go is absolutely amazing. So आपको बहुत बहुत मुबारक हो, बहुत congratulations.
Thank you, ma'am.
And it's celebration time. Nishta is still not. I think वो अभी भी shock में ही है with her result. Right? But
मैम
I'm
मतलब
sure.
मेरे को विश्वास नहीं हो रहा.
हाँ, I know. I can.
ऐसे बोल रही है, मेरे को विश्वास नहीं हो रहा, ये कैसे हो सकता है?
Great. Hi, बच्चे. Congratulations.
Hello, ma'am. Yeah.
Great.
Yeah.
So, do you want to introduce yourself?
Ma'am, my brother.
Yeah.
Great.
I
Yes,
am.
I can make that out.
I'm
He's
his
so
brother.
proud of you. I can make that out.
Yeah. We are so proud of her.
Yes, absolutely.
Yeah,
And
yeah.
I'm sure कि family का बहुत 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 योगदान होता है, because the
Yes,
child
ma'am.
needs so much of
Definitely.
strength and support at this time that each one of you, I know has been through this exam with her. So
Yes, ma'am.
heartiest congratulations to the entire family, and I would
Yeah.
just say that sky is the limit for her. निष्ठा कौन सा ब्रांच करना चाहेगी बच्चे?
Ma'am, अभी तो I have not decided. Like देखते हैं
अभी
रेडियो और मेडिसिन.
ग्रेट. सो चलो डिसाइड करते हैं. आई एम श्योर जो भी करेगी वो बहुत अच्छा करेगी. वी विश यू अ वेरी वेरी ब्राइट फ्यूचर. निष्ठा, कुछ छोटा सा एडवाइस, एनीथिंग दैट यू वांट टू गिव to anybody who's listening to you right now for INICET, what would you want to say? And even for NEET PG, we have like last 20 days, and revision is the key. And we've been telling them that do DVT and do a couple of readings, and you will be able to recall a lot of stuff reflexly in the exam.
Yes, ma'am. Like, what I would say like, it all depends on what you do in those 3 hours. Like, how much you have studied, how much you have practiced. It depends how you perform in those 3 hours. So it's very important, first of all, that we go very calmly that day in the exam and give our best. Like, don't take any stress of anyone, like what parents will think, what our friends will think. We have to be very calm on that day. That matters the most. And the last is revision in the last 10 days. That is must. You will have to stop somewhere. Ki, jitna content ho gaya, and then you have to revise in the last 7 days, and main is PYQs.
Absolutely. So great going, Nishta, and we wish you a super bright future ahead, bache. Keep smiling and go celebrate and relax. Karo. बहुत अच्छा किया है. Thank you for making DAMS a part of your journey. God bless you. Thank you, ma'am. Thank you so much.
Thank you so much, ma'am.
And wish you good luck. Take care. Bye bye, beta.
Bye, ma'am.